What's up guys, welcome to another video at Movement Mechanics and welcome to the sixth video at the anatomical journey that we are covering on movement mechanics. Now in this video we are going to understand one of the most important muscle group and the most injury prone muscle group, the rotator cuff of the shoulder girdle or the shoulder joint. Now the rotator cuff is combined of four muscles: the supraspinatus, the infraspinatus, the teres minor and the subscapularis. Now as per the traditions, we are going to understand the origin, insertion and the muscle action of these muscles, and at the end I am going to give you one exercise for training your rotator cuffs. So let's dive deep inside this topic and understand some movement mechanics. Firstly, we'll start off with the posterior aspect of the rotator cuff muscle group and we are going to cover the teres minor. The teres minor originates from the lateral border of the scapula and inserts at the greater cervical of the humerus. The muscle action for the teres minor is shoulder external rotation, but the most important muscle action of all the rotator cuff muscle groups combined is stabilization of that shoulder girdle or the shoulder joint. When it comes to the eccentric muscle action, of course, if it is going to do external rotation of the shoulder joint, it will do internal rotation when it comes to the eccentric muscle action of the teres minor. Moving forward from the teres minor, we are going to talk about the infraspinatus. Now the infraspinatus muscle originates from the infraspinous fossa of the scapula and it inserts in the middle facet of the greater cervical of the humerus. The muscle action for the infraspinatus is external rotation when it comes to the concentric muscle action, and when it comes to the eccentric muscle action, it would be shoulder internal rotation. But the most important muscle action of this muscle is again stabilization of that shoulder joint. Moving forward towards the supraspinatus muscle. Now, the supraspinatus muscle originates from the supraspinous fossa of the scapula and inserts at the superior facet of the greater cervical of the humerus. For the muscle action, of course, it again does shoulder external rotation concentrically, and eccentrically it will work when there is shoulder internal rotation. And the most important aspect is again the stabilization of the shoulder girdle. Lastly, we are going to talk about the anterior muscle of the rotator cuff muscle group, the subscapularis. Now, the subscapularis originates from the subscapularis fossa of the scapula and inserts at the lesser cervical of the humerus. When it comes to the muscle action, of course, it will do internal rotation of the shoulder joint. Also, it will do adduction of the shoulder joint. That means bringing the arm away from the body towards the body. That is also one of the action of the subscapularis. Moving forward from that vigorous anatomical lecture, let's understand the exercises which would be done for strengthening your rotator cuff. Now, the only one muscle which has got different muscle action is the subscapularis, and hence we have to give you two exercises. So the one best exercise for training your posterior aspect of the rotator cuff would be external rotation with the band. May it be done at the isometric position or may it be a dynamic external rotation with a band or a cable. If you are doing as an isometric muscle action, isometric external rotation, then you should use heavy resistance band or heavy resistance on the cable. But if you are doing dynamic, then the load has to be slightly below. On the other hand, if you want to train your subscapularis, then you need to do the opposite exercises of your posterior aspect of the rotator cuff, the internal rotation. Now this internal rotation has to be done in a dynamic way because isometric internal rotation is not that effective. Hence you should be doing it in dynamic but with slightly heavy resistance. Now the resistance has to be slightly heavy so that you get maximum engagement of that subscapularis and not just your anterior deltoides working. I hope you guys have understood the anatomy of the rotator cuff, the origin, insertion and the muscle action, and loved the exercises which I have given at the end of this video. So if you have loved this video, make sure you hit the like, the share, the subscribe as well as the notification bell icon so that you never miss a video whenever I am uploading a new one. Also, if you have got any doubts and comments regarding this video or any other video suggestions which you want me to cover in the future, make sure you drop that in the comment section. Till then, see you in the next one.